Health Department has noted a message circulating on social media about the detection of a new Omicron subvariant of COVID-19. The ministry confirming that this subvariant BA.2.75 was first detected in July 2022. The Health Minister, Phaahla, joins us for more on the story tonight. Minister, good evening to you. Thanks for your time. So, lots of concerns by the department around the messaging that has been circulating around this variant. What in particular have you been worried about?
What we've been worried about is the fact that we must always communicate correct information so that people know exactly what is happening, so that we don't cause any unnecessary panic. So when we saw some circulating stories about supposedly a new variant which is supposed to be presenting with very subtle symptoms and which can be quite fatal and all that, we got worried because it's very important that the messages which we are communicating to the public have credibility and have scientific backup. And that's why we got concerned and had to correct that misleading message.
So ultimately what you're saying is that, yes, this is a subvariant, but certainly nothing that should cause alarm at this point.
Well, let me just say, Kathy, and the viewers, that even though we have lowered and actually lifted all restrictions on the 22nd of June, our teams, both from a clinical point of view, laboratory through the NICD, and also the genomic sequencing network, they continue on a daily basis to look at the patterns. So we are very vigilant in terms of making sure that the monitoring is going on. And just in terms of the correct position is that just in terms of the variants or subvariant actually, since the Omicron in November, there has not been any new substantive variant, both in South Africa and in other parts of the world. There's been subvariants of the Omicron, subvariant 2, started with 1, 2, 3, then what is remained circulating, it's subvariant 4 and 5. There was the 2 in July, the 2.75, which is being quoted, was picked up amongst many other subvariants. In fact, when they give us the numbers, it shows how this virus changes quite often. It's just one of over 45,000 over the last 2.5 years, and just this year, just over 12,000 small mutations. But it's been very, it's insignificant. It's what is called the variants of interest, but not of concern. And even also on the clinical picture, for instance, the numbers of positive cases do fluctuate from time to time. Just in terms of the last week, the overall weekly positive test was just under 1,300 over a week, slightly higher than the previous week, just by about another 50 or 100. Positivity rate at about 4.6 positive, just about 0.5 higher than the previous week. So we're monitoring all this, and all that you want to say is that the COVID virus is still in our midst. We still need to protect ourselves. But at this stage, the changes of the virus which have been noticed have not yielded any clinical worry in terms of epidemiological and clinical presentation.
Of course, following on, this is the messaging around this so-called subvariant. Many South Africans anecdotally will share stories of what they feel like is a worse bout of flu in the last couple of weeks or so.
Well, it's true we have got reports both from the NICD and also from clinicians that quite, interestingly, as the spread of COVID has been at its lowest since 2020, because of the fact that we are less, careful in terms of, you see, the steps which were taken for COVID helped us to prevent other respiratory viruses. Firstly, just in terms of wearing masks, especially when it was both indoor and outdoor, avoiding, gatherings, again, especially indoors. Just in terms of those, the social distancing, all those steps helped us to contain the spread of COVID, but also the spread of other respiratory viruses, such as influenza. So once we removed all those restrictions, the circulating respiratory viruses almost like came back in a vengeance. So that's why we have had those reports, but in the majority, a few of those were found to also have COVID with them, and the majority of them were just variants of the flu, influenza viruses, and not necessarily the COVID. And there were reports that some people actually had much more severe flu, but most of the people have recovered. So it's just that we had the benefit in the restrictions and all the measures of containing the spread of COVID, which now we have lost in terms of other respiratory diseases.
And then, Dr. Phaahla, just on the issue of COVID-19 vaccines, how is the health department handling the confirmed deaths as a result of the administration of, in particular, Johnson & Johnson vaccines? Because SAPRA the other day coming out to confirm that there's now a second death in this country that has been verified.
We right from the time when the vaccination program started, because of the known fact that all vaccines, including the new ones for COVID, there will be side effects or adverse events associated with vaccines, as there have been with even the vaccines which we have used over the many decades. They do manifest in some few individuals with adverse events. That's why we set up specialist teams and procedures through which any adverse event will be reported and examined and investigated. And that you would remember also that some of these adverse events, even outside South Africa, they were picked up before. But what is important is that we set up the systems so that if any such event was to happen, it will be thoroughly investigated. Sometimes, it takes a bit of time. That's why the clinical teams and also finally SAPRA as the authority is now reporting on these particular cases. So we do have those systems so that anybody who experiences that, can be attended to and verified. Now, but what we need to emphasize is the fact that even these adverse events which have been picked up in as far as the Johnson vaccine has been confirmed. In terms of actual occurrences, it's very, very rare. It's rated as something in the region of about 1 in about 250,000 cases where there might be a serious adverse events. As you would know by now, we have administered over 37 million vaccine doses to over, if we include the younger people below the age of 12, just under 23 million individuals have received the vaccines. And in terms of the Johnson & Johnson itself, just around 10 million individuals have received the Johnson & Johnson. So we are not underestimating the impact on the individuals who have been affected. But we want to say in the context of what these vaccines have been able to achieve in terms of overall prevention of severe illness in the population. These adverse events, as regrettable as they are still a very, a small kind of, occurrence. And it must not discourage people from continuing to receive vaccination.
Is the department facing any liability claims on this matter?
Well, as you might be aware, as part of the program, we were obliged to establish a liability scheme,
yes,
a no-fault liability scheme. So in any situation where this has been proven, as in these two cases, they go directly into the no-fault liability scheme, and such will be compensated as already provided in that no-fault liability scheme.
Do we know at this point just what that compensation will look like?
Not really. I don't have, because we've got the teams, there are processes. So once this is confirmed, then it goes to the specialist teams, which include actuaries, lawyers, who will then work out, there are various permutations in terms of then what do they consider, for each individual, what their responsibilities would have been, the dependence of that particular individual, and so on. So there are people, I'm not a specialist in that area, but we do have the teams which are specializing in evaluation, and then once the evaluation is made, a quantum will be arrived at, and the dependence of that individual will then be compensated according to that scale. So at this stage, unfortunately, but depending on, some of this may also be protected information. I'm not too sure. We need to check with the lawyers when that kind of finality is reached, whether such information can be made public, or it depends on the dependence of the person who has passed away. So we'll have to look at the law and the rights of people in terms of whether some of this can actually be made public, or whether we'll need consent of the dependents of such individuals.
Health Minister Dr. Joe Phaahla, let's leave it there for tonight.